Hi, my name is Maddie. I'll be your student nurse today. I'm going to do a quick assessment on you. Do I have your permission to do that? Okay,
Yes.
I'm going to wash my hands. How are you doing today? Are you in any pain?
No.
Nothing? Any uncomfort?
No.
Do you have any complaints?
No.
Can you tell me your age?
20.
What's your race?
Filipino.
Okay. 20-year-old female. I'm assuming, yes.
Yes.
20-year-old female Filipino. Can I get your name?
Trinity.
Okay, nice to meet you, Trinity. Do you have any health issues? Are you all in good health?
No
Nothing?
health issues.
Okay. I would say you're a vigorous, healthy 20-year-old female. Can I get your height?
5'8".
Okay. And what's your weight?
140.
Okay, let me check my BMI. Okay, your BMI is 22. It's good, healthy. I would say your dress, your grooming, and your hygiene look good. Your demeanor is kind and cooperative, calm. Your affect is animated, and your thought patterns seem to be logical. Can you tell me your full name?
Trinity Rose Onrine.
Okay. Can you tell me where you are right now?
I'm in the nursing department at Franciscan University.
Okay. Can you tell me which day of the week it is?
It's a Tuesday.
Okay. Your intellectual capacity seems good. Can you tell me who the president was before Trump?
Barack Obama.
Good job. Can you tell me my name again?
Maddie.
Yes. If I were to say an apple a day keeps the doctor away, what would you interpret that as?
That eating fruit keeps you healthy.
Oh, good job. Okay, so your judgment is good and intact. If it was snowing outside, what would you do to prepare to go outside?
I'd wear a heavy coat, a hat, and gloves.
Okay, good job. Is it okay if I take your temperature?
Yes.
Right. Right. How do I just put it to your, like this?
Mm-hmm.
Just go?
Press start.
Okay.
There you go.
97.6. Good. Alright, I'm gonna go ahead and take your vital signs, starting with your pulse. Can I grab your hand? Okay. Let's see. Okay, so your pulse is 80, 84, and then your respirations are 14. Okay, I'm gonna go ahead and take your blood pressure. Thank you. Okay, good. Right. Do you want to get this thing?
Yeah.
Or you're just gonna hold it? Well, I need to see it.
Do you see it?
Yeah.
Okay.
Thank you. Okay, I'd say it was 123 over 79. Is that typical for you? Perfect. Okay. Okay. Alright, let's see. Let's go move over to the bed for a second. Okay. Just off of looks, I see that you have appropriate structure and shape, and so that all looks good. I'm gonna look at your skin. It's warm, dry, the temperature is good. No excess fluids or anything, or moisture, I mean. Okay, I'm gonna pinch your skin right here just to check your skin turgor. Skin turgor looks good. I'm gonna see your collarbones. Good, symmetrical. Now I'm gonna palpate your sternum, see if that's good. All the way until the xiphoid process, which is good, nice and straight. Looks good. I'd say your shoulders are symmetrical. Can you give me a shrug? Good, nice and strong. No, actually, I'm gonna have you turn your head and I'm gonna check your respiratory excursion.
Yes.
I'm gonna put my hands on your rib cage and just take a good deep breath in for me. Good, nice even expansion. It's deep and symmetrical. Now I'm gonna check your skin for any lesions on your sides, your lateral sides. Good, looks good. Okay. Appropriate flesh tone, no lesions. Okay. Now I'm gonna move to your back. Okay. Your shoulders look good. Your scapulae, sorry. Feel good, symmetrical. Borders. Okay. I'm sorry. Okay, now I'm gonna do your spine and see how that is. 7. Good, nice and straight. No signs of scoliosis. Now I'm gonna check your respiratory excursion on the back side. So I'm just gonna place my hands here. Have you take a nice deep breath in. Good. Nice, even. So I'm going to assess your thoracic diameter. I'm going to place my hands on your pectoral muscles and your scapula. And now I'm going to measure back here. It should be make sure you get this part. The thoracic to the spine should be the same amount to here. Here. Yeah, see, that's good. Even, appropriate thoracic diameter. I'm going to check your appropriate spine curvature. Your S. Good. Looks good. Negative for scoliosis. Okay, now I'm going to listen to your lungs. Can you start?
That's okay.
Okay, I'm going to have you look to the right, and I'm going to have you take breath in through your mouth, deep breaths, but no faster than normal. And I'm going to listen to your lungs. Okay. Good. Okay, so your rate was consistent with vital signs. Rhythm was regular, depth was deep, effort was non-labored, negative use of accessories when you breathe. No extra lung sounds. I heard good vesicular breath sounds throughout. Right now I'm gonna do your posterior and listen to your lungs on your back. Same thing as before, breathe through your mouth, look to the right, and try not to breathe any faster than normal. I forgot. I'm gonna have you hug yourself to separate the scapula so I can get good breath sounds.
Do I like lean?
Hmm?
Do I like lean forward a little bit?
Mm-mm.
Is that
Nope.
No, you're good.
okay?
Good. You can relax. And say that your rate was consistent with vital signs. Again, on the posterior, rhythm was regular, your depth was deep, effort was non-labored, negative use of accessories, no extra lung sounds. It was vesicular throughout. Yeah, and that's good. Okay. All right, I'm gonna have you lay down for me. I'm gonna check to see. Move this way. Okay, come closer so you can just see her chest. Yeah, maybe come this way and just focus on her chest. Okay. I'm not seeing any heaves or lifts, just from observation. Alright, now I'm going to check for pulsations around your chest. I'm going to go ahead and check your chest out for any thrills or pulsations where there shouldn't be. So I'm going to start into your second intercostal space. Negative for pulsation. Negative for thrills, and that was the aortic. Now I'm going to go over to the pulmonic. Negative for pulsation. Negative for thrills. I'm going to go down to Erb's point. Negative for pulsation. Negative for thrills. I'm going to find your fourth intercostal, or your fourth rib. Negative for thrills, and negative for pulsations. I'm going to go down to your fifth rib, intercostal space where your tricuspid is. Negative for pulsations. Negative for thrills. I'm going to go ahead and check your mitral. This is the point of maximum impulse, so there should be pulse, which I feel. Yeah, so that's good. There were no pulses or thrills where any pulses or thrills should not be. And then where there were supposed to be pulses, there were. Oh, okay. Okay, now I'm going to listen to your heart sounds 3 times through to make sure I'm not missing anything. I'm going to begin, same place at the aorta.
Amen.
Okay, now I'm going to go ahead and listen to your heart sounds. Do I have your permission to do
Yes.
that? Okay. Let me find Good? Okay. Good. And that was your aortic. So we're going to go to your pulmonary. good. Herbs point. Good. And go to tricuspid. Good. And your mitral. Good. Okay, I'm gonna listen back through. Mitral. Good. Tricuspid. Good. Herbs point. Pulmonary. Good. And then aortic. Good. Negative for any high-pitched heart sounds. Now I'm going to go back through with my bell to look for any low-pitched heart sounds. Same thing as before. Good. Pulmonary or aortic, now pulmonary. Good. Now Erb's point. Okay. Tricuspid. Good. Mitral. Okay. Negative for any low-pitched heart sounds, which is good. Your rate is consistent with your vital signs. Your rhythm is regular. The intensity is strong. The duration is just a tap, so that's good.
You're fine.
Okay.
You're fine.
Relationship between S1 and S2 sounded good. S1 being at your base and the apex, and your S2 being at your base. It was a good relationship. Okay. Yep. S1 was louder at apex. As I said, S2 was louder at the base, which is the aorta. Okay, now I'm going to go ahead and percuss your chest. Find it, your second intercostal space. Here. Okay, I should hear resonance. Good. As I move on to your sternum, I should start hearing some dullness. Yep. And then resonance again. Good. Okay. Perfect.
Yeah.
Good job.
Damn, girl.
That was
Good.
good.
Damn good percussions.
That was really good.
Okay. And that is the end of my assessment. Thank you for your time. Goodbye.